How to operate the MOVES SLC. Controls on the MOVES SLC. On the navigation keypad, you'll find the following buttons. The screen brightness button to control the brightness of the display. The flip screen button to rotate the information displayed on the screen 180 degrees. The alarm audio pause button to either silence all alarms permanently or temporarily. The non-invasive blood pressure control button to start or stop a non-invasive blood pressure reading. The suction button to start or stop suction. The jog wheel to navigate and make selections, and the back buttons. Turning the jog wheel clockwise or counterclockwise selects an item in a circular manner going around the screen. Activate the selection by pressing the jog wheel. Press the back button to cancel an active entry. The display screen can be locked or adjusted to face either the right or left side of the MOVES SLC to support operation from either side of the unit. Turn the catch 90 degrees to the left or right to unlock the screen and allow it to be raised into a working position. Use the flip screen button to adjust the display orientation as needed. Pre-use test instructions and launching sequence. Locate the power control button on the rear of the MOVES SLC unit. Press the power control button to activate the unit. An audible alert is sounded, and if the system has been run within the last 30 minutes, the new patient screen will be displayed and will ask if the operator would like to configure the system for a new patient. If yes is selected, all system settings, including alarms and limits, are reset to their default values. If no is selected, all system settings, including alarms and limits, are retained from previous use. Select No if the system is connected to the patient on whom it was last used and you want to keep all the previous settings. If there has been a data loss or corruption of previous data, the operator will not be allowed to restore previously used values. The No option will be unavailable. The operator will have to reconfigure the system manually to return to the previously used settings. System test screen. After you have chosen to configure a new patient, the system test screen is displayed. You are presented with 9 system checks, some of which require operator input. For further detail, refer to the MOVES SLC Operator's Manual Quick Start Guide for Ventilated Patients in the Pre-Use Test Instructions section. Do not connect any sensors or the breathing circuit to the patient prior to performing system tests. Ensure that the ventilator cartridge has been installed for the system test. Do not operate the MOVES SLC system until all system test failures have been resolved and all tests have been repeated and passed. Only use skip tests if the system test has previously been performed and passed, or the system has just been restarted due to power loss. Some tests, including RAM and firmware integrity, are automatic. Using the jog wheel, highlight and select the test which you would like to run and follow the instructions on screen. If all tests are successful, the system test screen displays a test summary indicating all tests have passed. Select Continue to move on to the setup screen. If any individual test fails, please refer to the MOVES SLC Operator's Manual, System Test Failure Messages and Causes.